Number 3, which I should have said actually is the first most important thing to be doing in this trimester, is working on your pelvic floor. If you have the resources to get pelvic floor physical therapists, cannot recommend this enough. Pelvic floor physical therapy will prepare your entire pelvis for delivery and also will strengthen it so that by the time the baby is coming along, you have a lower risk of tearing. Your pelvic floor can handle the weight of the baby's head without like falling apart, without your organs trying to fall out. I remember discovering pelvic floor physical therapy actually kind of accidentally because I wanted physical therapy for pubic symphysis discomfort, which was very uncomfortable for me. And then when I went, I started reading up all this stuff, and I was reading a book called Bringing Up Bébé and found out that French women get, like, as part of their postpartum care, they get pelvic floor PT. And I was like, well, sign me up for that. And so when I got it, I was like, oh, this is what it's supposed to be. And then I ended up becoming very good friends with my physical therapist. If you want to learn more about the pelvic floor, my first 2 episodes of this podcast were with Dr. Esther, and we talked about all the things you need to know about pelvic floor. Really, really, truly, like understanding how your pelvic floor works and actually learning how to do Kegels from a practitioner, not what Google tells you to do. And also, like, they can evaluate whether your Kegels are strong enough, whether you're doing them right, because the majority of people do them wrong. And that preparation is so important. I think is more important than like preparing for actually going to have the baby, because your pelvic floor is like what carries the entire pregnancy. And having a solid foundation is literally like having like strong muscles in your arms so that you can be able to like bring all your groceries into the house in one trip. And then choosing a pediatrician. So I highly recommend understanding where your pediatrician's office is located, the pediatrician you want to have as a choice, being able to interview that provider, and just kind of seeing if you gel. Because again, this is a relationship you're going to have with this person for about 18 years and your child too. So getting into a point of comfort and knowing that this is somebody you want taking care of your loved one, your most precious possession, which is your child. And then also like knowing their hours, especially for those of us in medicine, do they open after hours? They have weekend hours for sick care, which is one of the things for us that attracted us to a pediatrician's office, is that we didn't have to go to urgent care. If we needed to see a pediatrician on Saturday, they had a sick clinic for sick kids on Saturday, so we could get that done. And then just like the way our pediatrician engaged with us, we knew we had made a solid choice, again, based on recommendations from other people. And we actually interviewed a couple of pediatricians just to get to a comfort level. And we love our pediatrician. She's amazing. And then cord blood and tissue banking, this is a good time to start determining whether or not you want to do that. There's science that supports doing it, and I'm not going to get into all the details of all of us. As a family, we chose to do it because we knew that we were only going to have one child by choice. And so we wanted to have the ability, if in the future she should need some sort of stem cell, that those cells were available. If they could be used, they were there. If you opt not to do cord blood and tissue banking, but you still want to like support science and support stem cell research and stem cell provision of care, you can actually donate to a public bank. I know here in Houston, MD Anderson Cancer Hospital has a tissue bank, and they actually send their consultants over, and they actually like ask you questions as far as if you want to do it and the process. Now, if you would like to bank blood and tissue, a lot of the companies have discounts for healthcare providers. We went with CBR. They gave us a great discount, and we continue to use them, not had any issues with them. They have a very good like customer service, very good about answering our questions. So that's just, I'm not advertising for them by any means, but we've had a great experience with CBR. The other thing that you might want to start thinking about if you're going to have a male child is whether or not circumcision is in the cards for you and your family. And have that conversation with your spouse, have the conversation with a pediatrician, interview a urologist if you want to go with a specific urologist to do the circumcision. Be fully aware of the pluses and minuses of doing it or not doing it, and then be comfortable in your decision. Whatever decision you decide, if it's for religious issues, religious concerns that you want to do it or don't want to do it, it's totally up to you. But I think make a choice from an informed point of view. Then the fun thing you could do doing in this trimester is scheduling your maternity shoot. Highly recommend doing it when you're not like super like close to term and just cannot, walk without like hating the walking and just enjoying the pregnancy. And I feel like in this trimester, you're kind of in your glow and you're just like feeling amazing. And so you can start scheduling it now so that you can get it done. I believe our photographer will do it at 32 weeks. So this is a good time for you to schedule it, interview some photographers, see what aesthetic goes for you, and then proceed with it. Again, another thing which is so crazy, especially living in a city like this, a lot of newborn photographers get booked way ahead of time. So if newborn photo shoot is in your radar, highly recommend just going ahead and scheduling it now. Also recommend deciding on a baby shower day, deciding on what you want as far as your nursery, and then kind of start doing some research because again, at this point, you now have about 13 weeks left of your pregnancy. That's around 3.5 months. So you don't have a long ways to go. So this is a good time for you to start thinking about all those things. What I want you to take away from this episode on the second trimester is that your health is in your hands. And, we have just had so many conversations in the last year about maternal mortality, and especially in women of color. And so I really want to share this information, even though I know a majority of you listening are in medicine and you understand how these things work. But I want you to consume this episode from the perspective of a patient and from the perspective of somebody receiving care, and learn how to advocate for yourself, learn how to ask questions about your care and being assertive about your care. We have lost way too many moms in pregnancy for us to be quiet. We do not get to be quiet anymore. We have to ask the questions that we need to be asked, and we have to be comfortable in our choices. Your takeaway, honestly, from this podcast episode is be the advocate for your care. Be the advocate that you would want to be for your patient. Make yourself your own patient and advocate for yourself.